Whoa.
What's
And
up
that
there?
that like changed so many things. Like
Yeah.
so cool. Like, what started was the burn. And so I had to figure out how do I do this?
Mm,
And so I don't know, that was life altering. I really appreciate it. As awful as it was, I wouldn't even wish it on my worst enemy. It was
yeah.
definitely something that made me have to
Mm,
back off and, use less pressure, but then realize in my doing so, like
yeah.
they're actually responding better to
Mm.
less pressure.
What are some of the common things that you think a massage therapist that has been treating for maybe a year or two is uncomfortable with in their treatment?
What I'm hearing you, or at least where my mind goes, is as far as like different areas of the body to treat, that's usually what comes up. So, like,
Mm.
what I'll hear is often like neck massages. Neck massages, that's an area that most people are saying either they don't know how to fully treat it well enough, or a patient or will come to me and go, no one else does a neck massage like you. So I would say that's definitely one thing, because that was why I developed the neck massage that I did, was because I was getting them, and it was like there's so many muscles that just aren't being treated. And so that's definitely an area. And then abdominal work. I've definitely started doing more abdominal work, and it's something that of course I've been aware of for a long time, of how important and significant it is, even like treating the psoas and the hip flexors for low back pain, like something like that. I've known for a long time how significant it was. And so that's another area though that most massage therapists don't really know how to treat. They feel, one, it's because it's so deep in there. It's like, how do I know I'm where I want to be? And I think often teachers like scare us and they make us think that, oh, this is like a specialty thing. Whereas for me, I remember my teacher talking about like working on the psoas and the iliacus, and I was just like, oh, I can't wait to get in there, because she was talking about how like it was just a rare thing for someone to know how to do it. And so I could not wait to learn how to do it, because
Right.
I felt like, and then especially once I learned how significant of a muscle those it is, it was just like, okay, no, we definitely have to learn how to do this. And so that's another area. And then I think, I mean, I feel like there are a lot of massage therapists who do a lot of footwork, but in more of a relaxation sort of a way. Like they don't tie it into the rest of the body. So I often, like, I was so afraid to like really focus on the feet, because I had so many patients come to me and go, yeah, I went to this place, but they did mostly footwork, and so I'm really looking for someone to do something more than that. And so that made me feel like, okay, well, they're not getting the results that they want when they were having their feet focused on, so then maybe that means that I should be focusing on something else. But the more I've been focusing on feet, I realize, like, no, the feet definitely need to be focused on. However, it needs to be tied in with the rest of the body. Like, you can't just stop at the feet. Ideally you would work on the other areas as well. So
Thinking of the neck, what are some muscles that you already know off the top of your head that are like, we want to start training on those because they're commonly missed?
so commonly missed, I would say levator. Most people kind of mistake a lot of issues in the levator for trap. And so levator and scalenes, probably scalenes are, I mean, I've had people who there's like dizziness and tingling in the ears, and it's because their scalenes are so tight. That muscle, I would say, is probably, or those muscles are probably the most undertreated and misunderstood muscles in the neck. And so I would probably do there. And then probably the hyoid bones, like, I mean, the hyoid muscles, like
Mm.
both infra and supra. Like, the more I'm feeling, sometimes the stuff I feel throughout the suprahyoid muscles, I'm like, yeah, this has to be contributing to a lot of their neck stuff, because it's just so tight in there. And so I would say probably mostly anterior neck is where most people, and then because of all the vessels, most massage therapists aren't comfortable treating the anterior neck. And I even kind of remember going through school to some degree, and they're like, you stay away from the anterior neck. And then once I got started and learned more and more about it, then I learned how to safely treat it. And it's like, oh, you're doing people such a disservice by telling them not to treat this area, because there's so much going on in here that, of course, is affecting everything else. And then not just like when this is tight, you're like everything here is usually an indication that things are tight here. And so branching off into the pecs and then even into the abdominal area is like a pretty good segue for, that. And then with all the lymphatics would be the next thing. So like in an area like the neck, I would probably start with lymphatics actually versus even the fascia. From my work with the lymphatic system, I find that the fascia is so closely related that if you really focus on gently releasing the fascia, you're going to get the lymphatic system moving.
Yep.
And so in the area like the neck, what I've started doing is more than just jumping right into fascial work, is jumping into the lymphatic, getting the lymphatic system moving, and then working on the fascia, and then working on the muscles. So I guess more just taking the body in layers, and instead of, because I feel like for so long I worked where I started and just pushed right through that, the surface layers, thinking, oh, I just got to get to that deep tension, right? Because that's what we are trying to get worked out. But the more and more I've been working lately, it's like, but what if you start surface? One, it's so much easier on me. And two, there are things there that are really important that should be treated. And so once I started treating that stuff, it was like, oh, I mean, this area, it's so amazing, because like getting this loosened up and like getting the lymphatic system going in this area first, and then starting on that myofascial release, like people, like you can even start seeing, like you'll see people start swallowing, and it's like, it's so cool. Like you can start seeing the movement, and it's like, you don't have to work as hard, not nearly as hard as I used to work, and you still get you get an even better release. And then you don't get all of that, like there's less risk of headaches. Like, sometimes when you work deep in this area, sometimes people are like, well, I had a headache for a little bit. There's less risk of that because everything is just draining the way it's supposed to. Now, when I'm teaching them, I'm kind of starting from the therapeutic, but I know that the foundation of my therapy is relaxation. It's, it's already there. It's already worked in. I'm not doing anything without considering what my touch is going to do to this person mentally and emotionally. We all have what resonates with us. So for some people, I guess that is like the more deep kind of torture work. And even for some patients, they like having that. But for me, I don't like the deep torture work, and like as in giving it or receiving it. And so to be able to teach people that that's not the only way to do it, and you can still do everything you need to do to help somebody to get back to, I guess, get back in balance without beating them up. And so for the longest, like focusing on the muscle, sometimes the fascia was just too tight for me to even do anything to the muscle. But I was like, in that headspace of no pain, no gain. And so I just got to push through it and get this muscle loosened up, and not considering what the fascia does and how it even relates to the nervous system. Now, when I feel fascia, I know, okay, I got to do something. I can't do the same thing that I would do on a muscle. Like I have to back off sometimes. In some cases, the fascia is so tight and restricted. If you the more you push in with pressure, it's just pushing right back at you. Yeah. And so that is definitely what it was. It was like the realization that, wait a minute, I shouldn't even be trying to get to the muscle at this stage. There's too much fascia restriction here to even begin to get into a muscle. I know I was taught how to do myofascial release, but for some reason in my mind that is still different than treating the fascia. Like, I don't know, it was almost like myofascial release was broken down into muscles versus fascia. Like it made it more a part of the muscle versus a thing all on its own. Right. And so even now when I was thinking about doing the treatment, my thought was more like, it's more the fascia. Like I don't want to just focus on the myofascia. I want to focus on all of the fascia, because I think that that's the part where we're really, for those people who are doing muscle work, you're of course you're having some effect on the fascia, but are you really having the total effect that you need? Because are you pushing past it and getting right into the muscle? Once I started focusing more on the fascia as its own system, not a part of the muscular system, that's when it started making sense, and it felt like, okay, this is what this needs. It shouldn't, like the thing I was doing before was actually pretty counterproductive, because it was just way too much pressure for where that fascia was. Even the muscle was like, oh yeah, I can take this all day. Probably the biggest component is just that we just don't know what we're working on, and so then therefore how to really work on it and like get in tune with it. And so we know that we're treating what we are trying to treat and exactly how to treat it.
So how would you teach someone that awareness?
I guess I would start out probably teaching what the fascia is, and I guess more of a like kind of looking at it as a whole and how it works, and how it just encompasses and really innervates everything.
So you would start with fascia?
I would probably start with fascia just because it is the most superficial, and there have been times where the fascia was just so tight that I couldn't even feel what muscle was going on because the fascia was just so tight and restricted. So
is there a certain area of the body that you think you would start with when it comes to fascia?
So initially I would say back. To me, back is easiest to feel. With teaching it, I would probably start there if the person didn't really have a significant, let's say the person we're demonstrating on, they brought in someone who didn't have a significant amount of fascia restriction, then I guess we would just have to find the area. So then definitely usually forearms around the, ankles, things like that are usually very fascia restricted. Hips usually have a lot of fascia restriction.
Not the neck.
Not the neck. Now,
Why not the neck?
It's a little more complex, especially at feeling the layers, like with the fascia, especially since, with the neck, someone can be very fascia restricted, but if they have a forward head posture, you're not gonna really feel it as much, so.
So, okay, so fascia, step one, with awareness, what's the next step?
So after we work on getting a feel for the fascia, what it feels like tight, what it feels like as it's responding, what it feels like after it's responded, then I guess we would just ease into the muscles in that area, because now we can feel what's going on in the muscles. So that would just be the natural step, because that's just the natural step in what I'm doing. And so what are the muscles in this area doing? If it's an area like the low back, how much movement? We got the fascia to loosen up. How much movement is in this area now? So is the lack of movement indicating more fascia restriction, maybe in a different area? Maybe it's more anterior in the hips, or is it a muscle that's restricted? And so then I guess we would go into the muscles in that area. Once I slow down and back off from that, okay, I gotta force it to move and all of that, then I can feel what it's saying. And that's usually, I know that was my biggest difficulty. And once I now being able to connect in that way, to where I'm not too deep, because it's there's this thing where you put too much pressure on the body and it almost stops everything. So everything kind of feels like it's just stuck, but it's not. It's what we're doing that's making it stop.
Yeah.
And so it's this delicate balance between getting in there deep enough so that I can feel what's going on, but then not too deep so that the body can still let me know what it needs and can do whatever it needs to do, because it almost just does it naturally. It's not me making it do anything. It just naturally starts doing it under the right circumstance, right? Yeah, so I feel when you connect, it just kind of takes you. Sometimes on a journey, it's sometimes past that area up into another area. And so sometimes when I'm telling people I just follow the tension, I'm okay, what does that really mean when you say that to a patient? But it really is, it's I just connected with the tension, and then because I didn't try to force it or try to move past it, I just stayed with it. And then next thing I know, I'm up here and I'm finding ooh, what is this?
What is all this?
There's no way this isn't involved in what you're talking about and doesn't need to be treated. And once we treat it, you get a whole lot better. So I guess that's kind of what it is. It's connecting to it and just, I guess, being able to feel into what it needs, but just allowing it to take you into whatever it needs, I guess. I don't know.
So the first step is like awareness, and then from there it's connection. And then from connection, you're giving the body what it needs.
Yeah.
In that precise moment. And you know what it needs because you've been listening this whole time through that awareness, through that connection. And now you're able to give it exactly what it needs. And that might be a certain type of touch. It might be a certain amount of touch. It could be friction. It could be your
rocking. It could be,
different movements, angle of your own pressure. That could change quite a bit. And that's when you start to feel the muscle change very quickly, or at least at its own pace. Instead of you forcing a change, you're now just being patient, and you're waiting. And if you're not in a rush, it actually feels like a very quick process.
It does, yeah.
And it might actually be a quick process, but either way, it's going to feel quick. Quick for you and for them.
Yeah.
Because if they're under an extreme amount of discomfort, it's the treatment is going to feel like it's taking forever.
Yeah.
Right? It's like holding a plank. 1 minute holding a plank
it's like
feels
the longest
like 20.
minute of your life.
It's so bad. But without that connection, without the awareness, the chances of you being able to give the tissue what it needs is just so low. You're really guessing, and sometimes you're probably going to get it right, which is awesome, and we always love that.
Yeah.
But you can't really have confidence in that.
Right.
And anyone that's working without that right amount of confidence is uncomfortable, and they're probably not happy with what they're doing.
Exactly.
And so in this training, when you have the awareness and then you have the guided education on where to take the muscle once you're connected with it, then the person that's learning these techniques is going to feel so much more confident. And that confidence is now really going to help their career in a couple ways. One, they're going to have a busier schedule, of course, because people are getting better and they're feeling great. They're telling people. And then the real added benefit, in my opinion, even beyond that, is that they're happier at their job and they have more longevity at their job.
Definitely. Yeah.
And that's really what you would love. I'm assuming you would love to give another therapist is that confidence and longevity.
But that was just some things that I was thinking about because I was excited about it.